Kalazi is my name. We are delighted to have you coming through this particular edition of Family Hour. Today is a Tuesday, and as usual, every Tuesday we talk health. And even today, we are not going off the agenda. Of course, there is a lot on our menu today here in Family Hour, especially when it gets to diabetes. There is a lot that you need to know. Today we are looking at this type of diabetes called Diabetes Mellitus. There is a lot that we really need to know about this particular type of diabetes. And of course, when you look at the prevalence, what is funny is that before you test positive of a particular disease, you will never know that the prevalence is high until when you are part of the other many people. So when we talk about non-communicable diseases, I've already said, find time and pass by Uganda Cancer Institute or the Heart Institute or those special clinics in Mulago and other hospitals. You'll be overwhelmed by the crowds there, and that is now a signal that things are not okay. Therefore, that is why we come here to take you through some of these as a way of creating awareness, especially giving you preventive measures, because prevention is better than cure. Now, today is a unique day, especially on a Tuesday. I think it's the first time we have a panel of gentlemen only. For quite some time we've been having a lady somewhere, but we are delighted to have two doctors in the house. I'll start with Dr. Travis at my immediate left. It's a pleasure having you with us.
Thank you, it's a pleasure too.
Kindly greet our viewers.
Good evening, our viewers. Dr. Mugabi Travis, and I'm very happy that we are going to talk about diabetes mellitus, which is one of the leading non-communicable diseases in our society. We are going to share a lot. Let me hope all of you're going to learn from this session. Thank you.
And then another gentleman, Dr. Chrisostom. It's a pleasure having you this evening.
Okay. Good evening, ladies and gentlemen. My name is Dr. Arinayezu Chrisostom from Gifted Hands Kulambiro. So today's session, we're going to look at diabetes mellitus. Yeah, so stay tuned, and we have a lot for you. Thank you.
Yeah, in case you want to be part of the live engagements in this show, please get to our social media platforms, whether it's Facebook, X, or you can as well watch us live on our website, www.coufamilytv.com/live. But also you can get to our YouTube channel. This show is streamed live. You can as well get into the live chat and send in your question, and it will be answered on this platform. But getting to the gist of this evening discussion, Dr. Travis, someone would really want to know what diabetes mellitus is, in a sense, because we hear diabetes, and of course some people change it from because traditionally we call it sukari, so people change it as to sugar in English. So when you talk about diabetes, someone is like, no, what is that?
Thank you. So first of all, we described diabetes mellitus and a non-communicable disease. So first of all, let's first describe what non-communicable diseases are. So briefly, these are diseases that cannot be transmitted from one person to another. For example, hypertension, already diabetes. We can have mental diseases. For example, stress. It's a disease. It's a disorder. It cannot be transferred from one person to another. So that's how diabetes mellitus is.
We've had people who say don't over stress.
So you cannot spread it from one person. Kalo is influencing and to such So yeah. So briefly, Another point you talked about echasukali. You've made me remember one time when I was at my clinic or with my colleagues. One of them is Waswa Brian. He remembers this story. Then one patient came and was like, Musao, nina sukari, I have sugar. So I was very surprised. I said, you have sugar? I thought maybe she had brought for me a kilogram of sugar. She was trying to describe diabetes mellitus. So scientifically, diabetes mellitus is a metabolic disease or a disorder whereby glucose cannot be metabolized in the plasma, that's the blood. So here, specifically, glucose cannot leave the bloodstream or the blood cells to go into the cells, to go into the other cells of the body. So roughly when those glucose molecules increase in the blood, we come about what we call diabetes mellitus. So briefly, you can call it is a metabolic disorder of glucose due to its increase in blood plasma. It is kindly categorized or influenced by insulin, whereby the body cannot produce increased insulin, or it produces little insulin. So when you have a lot of glucose, the body cannot work upon that glucose. We are going to see how it comes about, the pathophysiology of it. So I'm trying to briefly talk about it. Yeah, so we are going to also see how that comes about.
And actually, let us see how it comes about, because we are curious.
Yeah.
We really want to know how it comes about. Science, especially science of the body, is really funny. And when you don't understand some of these things, you may end up. That's why some of our people end up saying they're being bewitched or what, or there is a spirit that is tormenting them.
Okay. So whenever you go to the hospital, I know doctors sometimes don't give you the brief information about the whole disease. So briefly, we are going to talk about how it comes about. So the pathophysiology of diabetes mellitus, it comes about the following ways. How? We have a hormone called insulin, and we also have a hormone called glucagon. So roughly, these hormones, they work upon the glucose in the body. Insulin is specifically to regulate or to transport the glucose from the bloodstream, that is the blood, the blood, then it takes it to the cells. Then the other hormone, for it remember this cycle has to be balanced. The glucose in the blood and the glucose in the what? In the cells. So both hormones have to work hand in hand. Because when the glucose in the blood is a lot, that is another what? Problem. When the glucose is a lot in the cells, that is also another what? Problem. So they have to work hand in hand. So this is how it comes about. So roughly here, the body cannot secrete enough insulin and glucagon hormone. How? Insulin is mainly produced by cells which are called beta cells in the pancreas. I think we all know what the pancreas is. Sikamani in Uganda, what could you be knowing the pancreas in Uganda?
I think it is what they call a kalulu.
Is it? Yeah, so that's it. So insulin is secreted in the body by the pancreas in the cells called
the nuni.
Yes, by the nuni.
The nuni is commonly known in fish.
So it is secreted by that hormone, yeah, and by the cells called the beta cells. Then the other hormone is by the alpha cells. So this is what briefly happens. So when the body cannot produce the two, that means the glucose in the blood cannot be taken to the what? To the cells. How? And what happens? I know you're asking yourself, like, what really happens after that? It sounds like a
that
movie.
is the silence.
It sounds like a movie. So when the glucose is too much in the blood, it will stimulate a lot of processes. One is diabetic ketoacidosis. This is the increased acid in the what? In the blood. Another one, we shall have hyperglycemia. That is also another thing that will also happen in the blood. So diabetes, we have two types of diabetes. That's diabetes type 1, what we call the insulin dependent diabetes, also known as the juvenile diabetes, and it is mainly in the age of below 30 years and below. That's why it is called juvenile. It is always in the early years of life. Yeah. So we shall also talk about, so specifically I'm going to talk about the pathophysiology of diabetes type 1, how it comes about.
The juvenile.
Yes, the juvenile. How it comes about, its signs and symptoms, and so on. So here, remember, as I want you to remember, insulin is responsible for transportation of glucose from the blood to the cells. I want you to remember that, because that's where all the science rotates. So if you have, let me say, your body cannot secrete enough what? Insulin. This is what happens. So if you have, okay, before you're asking how can the body fail to secrete insulin in the body, so there are a lot of things that can cause that. First of all, we can have alcohol. We shall also talk about how it brings about that. Yeah, so we shall talk about how it brings about that, how smoking brings about all of that. So we are going to see. So insulin is responsible for binding onto the cells of our cells. So when it binds onto our cells, yeah, it opens what we call vesicles. Those vesicles are responsible for co-transportation of glucose from the blood to the what? To the cell. So its absence, that will mean glucose cannot go from the blood to the what? To the cell. Therefore, it will be in higher amounts. So yeah, that's one of the ways how diabetes comes about. We shall also see that. I just want you to pay attention through this session. Here, if let me say the body does not have enough glucose, remember the cells are not getting glucose right now. This is what will happen. The body will try. Remember, so before, let me first ask you a small question. Yeah. What is the importance of glucose in the body?
To give the body energy.
Very good. So if your cells don't have enough glucose, this is what is going to happen. The body will try to make its own energy. So it will try to break fatty acids. So when those fatty acids accumulate in the body, it is going to cause a lot of series of events in the body. We shall see. Those will be the signs and symptoms of what? Of diabetes. Yes. So another form of pathophysiology will be what we call it is a form of hypersensitivity, which we call type 4, whereby here the body has what we call T cells. So those T cells are specifically responsible for fighting antigens. So you know, T cells are like, I know a lot of you are asking yourselves what could be the T cells. So T cells are specifically like soldiers. They are specifically like soldiers. For them, they are responsible for fighting any enemy. Any enemy that enters the body, for them they come in. So this is what will happen. These T cells, they will see our beta cells as enemies. So they will come in to try to invade the enemy, thinking they are enemies. So when they try to invade, they will kill the beta cells. Remember we said our beta cells are responsible for the production of what?
Insulin.
Of insulin. So if those beta cells are killed, that means our insulin production is going to be what? Low. So that is one of the causes. And some of those antigens, we have what we call the human leukocyte antigens. Yes, HDL, DR3, and also 4. So specifically, those are the ones. So after that, this is what will happen to the body. We shall have. So I really don't know if I'm going too fast.
We are following. I think this is biology that we rarely listen to. I should say, or we rarely get, especially even when you go for a checkup. This is it is rare, like you say, that it is really rare that you get a broader explanation to exactly know how some of these things happen.
So. First of all, thank you for inviting me here. I'm going to try my level best to make these people understand. Yes. So we've seen our pathophysiology. So we are going to see how do you know that I'm having diabetes mellitus.
Before we get to, you said that you were only concentrating on type 1, and that was the juvenile diabetes.
Or what we call the insulin dependent.
The insulin dependent. But there's also the other type that we are leaving out before we continue. Maybe Dr. Chris can pick it up from there.
Okay.
Okay, thank you very much, Mr. Austin. So, as my colleague has said, that we have two types of diabetes mellitus, and that is type 1, which is insulin dependent, and type 2, which is non-insulin dependent. Yes, he has talked about type 1, and I will dive into type 2. So type 2, what happens, it usually comes in at the people with age above 40, and it is insulin. It is a metabolic disease that comes due to insulin ineffectiveness or insufficient. Yes, it can be also a combination as the disease progresses. Are you together? Yeah. So it is a combination. Yes, it can be due to insulin insufficiency, or it can be due to ineffectiveness of the insulin. We have the insulin being produced in our bloodstream, but then the body is not using that insulin to pick up that glucose from the bloodstream. Am I trying to make sense? Yeah. Yes, okay. So that is type 2, and it is usually in the adults. People get it with age.
So that is the common one we used to refer to as in what they have.
Yes, that comprises of the 90%. Yes, then the type 1 is the juvenile, which is gotten at the young age, and that comprises of the 10% from the 90. Yes.
Maybe the other question would be that you've said the body produces the insulin.
Yes.
But the insulin is not.
The insulin is not effective.
Effective.
Yes.
So someone would ask why? Why is it that the insulin is produced but not effective?
Yes. When this insulin is produced in the body, due to the lifestyle the person is living or how this person behaves, there are risk behaviors of a person that can predispose this person to get the type 2 diabetes. E.g., let's say people who smoke, drink alcohol, and then if you're 40 years and above, you're at risk of getting type 2 diabetes. Yes. So there are risk factors that predisposes our patients to getting type 2. And then, if at all there is a family history in the first degree relatives, yes, you have your uncle from paternal side or maternal side, they have suffered of diabetes type 2. Also, you are prone to getting this type 2 diabetes mellitus.
So someone would say, still, we look at a situation where maybe my uncle got diabetes because of their lifestyle.
Yes.
So how is that connected to me? How do I get the disease out of their, maybe, okay, I was going to use a funny word, reckless, but out of their lifestyle? Maybe they were taking a lot of alcohol and then they ended up getting diabetes. But how does that genetically gets to me?
Yes, one of the things also that can predispose someone to the type 2 is the genetical factors. Yes, because when you look at your genetical makeup with the siblings, all from the relatives, especially the first degree relatives, you have also that percentage that may predispose you to getting this type 2 diabetes.
So I cannot be the initiator of a particular condition in the family.
I've not
said the first patient.
Yeah, in the family you can, if at all you live, as you have termed it, reckless. If you at all predispose yourself to, if you keep on doing risky behaviors that expose you to getting type 2 diabetes, you're at risk of getting it.
Okay.
Yes.
I think some of these questions, the questions we find out there in the community, where someone says, I was okay, I have maybe hypertension, I have diabetes. Na if wafete tubuli no boburade. Abasawo balimba. I think as such statements. So it is important that someone knows that when you recklessly live your life, you can still be the first patient in the family, even when there is not such a history. Yes. But Dr. Travis, getting back to you, we are still, he had introduced risk factors, and I think let's add on to the risk factors, and then we shall get to where you had started afterwards.
Okay, so to talk about the risk factors, first of all, you might be asking, our dear viewers might be asking themselves, what are risk factors? Because we are talking about the what, but they might not be getting what we are talking about. So risk factors, these are the things that can predispose you to a particular what? Disease. They increase the chances of you acquiring the what? The disease. So specifically, and the first point would be genetics, as my colleague has outlined. Genetics, they play an important role. For example, and another point to add on him, these T cells, we talked about the human leukocyte antigen. If, let me say, you have them, the high chances that your kid will also have what? Those antigens. So obviously you're going to suffer from diabetes mellitus. So another one, it could be the lifestyle one, obesity. Oh, sorry. Okay. Let me bring it in this way. Poor feeding.
You need to explain that, because especially in the days we are in, that is an ambiguous statement.
Yeah. So a lot of people might be worried. What could be the poor feeding? Yes. So remember, we said specifically this is all about glucose, and glucose is sugar. We know that. So seriously, if you take a lot of foods that have higher concentrations of sugar, that's self-explanatory. You're going to have a risk factor of having diabetes, what? Mellitus, yeah. So one of the things that can predispose us to diabetes mellitus, people having a lot of soft drinks. They are really carbonated and they have a lot of sugars.
Speak to my colleague Jonan.
Mr. Jonan.
Jonan always tells us that for him, when he goes to any function, he has plenty of drinking water at home, so he can never take water. And he has met very many people around. So most of us, when you go somewhere, you can't take water. We have plenty of water, even here. So you want to take the other drink that you don't have at home.
Well, one wise man said, though I don't know that wise man, he said too much of anything is always what? Bad. I've not said don't take the sugary stuff. It is okay. But taking it in higher numbers or higher quantities, it increases the chances of acquiring what? diabetes mellitus. You can find somebody taking over 15 sodas a day without drinking water. Seriously, my colleague, I think we can see that. Yeah? So that is one, our feeding. Then to also add on the feeding, like taking a lot of foods with high fat content. So that fat content will lead to obesity, which is one of the increased all the of the highly ranked risk factor of having diabetes mellitus. So a lot of you people are asking yourselves, how does obesity cause diabetes mellitus? I don't know if I can talk it, I can describe it right now, or I can talk about it right now.
Please talk about it before the break.
Okay, so this is how it occurs. I know a lot of people are going to feel attacked, like obese people. Yes, are going to feel attacked, but please don't be offended. Yeah, it is not a crime or anything. Yes, and there is always medicine for what? It can be pharmacological or non-pharmacological. So this is how obesity is a risk factor. So when you have high fatty content, the body is going to try to break those fats. So when it breaks the fatty acids, it produces what we call ketones. Ketones go into our bloodstream. So when they go into our bloodstream, because ketones, by the way, are important. People might be worried, maybe ketones are dangerous. No, they are important. First of all, they provide energy. But too much of anything is always what? Bad. So when they go into our bloodstream, they are going to cause acidity of the what? Of the blood. The blood is going to be acidic. Remember, we have glucose. Now also we have increased hydrogen ions, which are responsible for the acidity. So you see now the mix we are having in our blood. Remember, this blood has to be taken, this blood contains the glucose, and now a lot of hydrogen ions, whereby they are going to be taken into the what? The cells. Remember, because that mechanism is always like that. Cells, blood. Contents are taken, all electrolytes are taken from the cells to the blood. It is sometimes vice versa, or sometimes electrolytes go together. When one electrolyte is entering, another one is doing what? Getting out. So I don't want to go too much into the science, because a lot of our viewers will be lost. Yeah. So specifically what I want you to know is obesity increases the acidity of what? Of blood. Yes, and that acid is not good for our what? For our body. So it affects our sympathetic and co-transportation system, whereby we shall have increased the potassium in the intercellular space between the blood and the cells. So that increased potassium will cause hyperkalemia. Was it?
Let us take a short commercial break. When we return, we are going to start from there. Hyperkalemia. Okay. Please remember that. And people are watching us on YouTube. Don't go. We are coming back.
Okay.
back from the break. This is Family Hour. We are talking health. We are talking about diabetes mellitus. And of course, before the break, we had something that came on board. And John openly said, but now we want to clear that was Dr. Travis.
Yes.
Hyperkalemia is what brought issues here. What is hyperkalemia? We start from that and we wrap it up.
So hyperkalemia, in simple terms, it is increased levels of potassium ions in the body. So in simple terms, that's it. So briefly, somebody is asking themselves, like, what could cause, okay, how would that interfere or affect our glucose levels? So hyperkalemia causes renal impairment or renal failure. And the renal is the, okay, when we talk about the renal system, we are talking about the kidneys. So kidneys play an important role in regulating the glucose levels. So if the kidneys have a problem, that means a lot of glucose is going to be getting out of the of the body through the urine, meaning we shall have reduced glucose levels.
Reduced glucose levels.
Then your body won't have enough glucose in the cells.
Wow.
Yes.
Now, Dr. Chris.
Yes.
Someone would now ask, how
Yes.
do I know I have, or I might, what I'm going through has something to do with diabetes?
Well, they are classical symptoms. While we are attending to our patients, they are classical symptoms that define diabetes mellitus. And we as medical officers, we categorize them and we say there is, in fact, we put them in 4 Ps to make it simple for us to diagnose diabetes mellitus, so that we cannot misdiagnose or miss out patients with diabetes mellitus. The first P will be polyuria. That is a frequent urination. Yes. How many times do you wake up at night to pee? Yes. Then we have polydipsia. That is feeling thirsty all the time. And then we have polyphagia, that is increased appetite. You find someone tells you that, doctor, these days I've had series, or I feel like eating all the time, but then these people are growing thin and thinner. Then another thing is polyneuropathy. They report that they are having pinprick sensations at the lower limbs, that is the leg under the feet. Yes, patients will report those 4 classical symptoms.
It's as if you have needles.
Yes, or numbness.
You.
Yes, that's what the patients will report to you when they come to your facility. Yeah, so those are the 4 classical symptoms. A symptom is what the patient reports to you. And the sign is what the doctor will do, will identify as as a healthy worker. So there are other symptoms. Yes, besides those 4 Ps, and then there is muscle wasting, loss of weight. In children, there is bedwetting also. Remember, we said there is that type of children, that juvenile type, that which was type 1. Yes, so we have also bedwetting. Yeah. Then we have frequent skin infections. Yeah, because the body is not getting enough glucose, so it is not being exercised. When we come to type 2, yeah, there is that physical inactivity of the person. So there is also that there is also blurry vision. They start complaining of the eyes, that doctor, you know what, I'm no longer seeing well. What could be the problem? Yeah. Then you assess those signs and symptoms. That's how you can tell that the patient is maybe having diabetes mellitus.
Okay.
Yes.
Dr. Travis, anything to add on?
I think he has exhausted some of the main important signs and symptoms.
Now there is something he brought in as blurry vision and the sort of things. What are the other complications that are associated with diabetes mellitus?
So the blurry vision will come about retinopathy, which will complicate into glaucoma. So glaucoma is just briefly increase the interocular pressure, that is the pressure of the eyes increases. Yes, in the anterior chamber of the eye. So one is glaucoma.
You know, I found someone saying that abazungu bagenda tutta. They even brought pressure of the eyes. The doctor told me I have pressure of the eyes.
So I think that will be another topic.
Indeed.
Because it's also something big. Yes. So just glaucoma is increased the pressure. I don't know from Luganda how I could call it. Pressure yomaso eberachi nyingi nti waliwo liquid gye tuyita aqueous humor. Bwe yeyongera mu maaso ofuna ekirwadde kye bayita glaucoma. Briefly saagala genda nnyo mu kyo, so ekisooka eyo glaucoma. So ekyokubuli complication esinga obukulu gye tulaba kye bayita diabetic foot, ekyo kyemmanyi waliwo kirabyeko, eryo libeera nga bbwa eryokukugulu. Yes, it is called diabetic foot. It is all about neuropathy in the foot, whereby the nerves get damaged. The blood supply also is interfered in the foot. That means in case you get a tiny wound, for it to heal, it's going to be a big problem. So we've seen glaucoma, diabetic foot. Then you will also have higher chances of acquiring heart diseases. For example, heart failure. You might have hypertension, angina. Yes.
What is that?
It is also a heart problem. So I don't want to go.
We shall get into it when we get an opportunity next time.
Yes. Another complication could be oral ulcers. Yes, I think some of you have seen those patients who have wounds in the mouth. Yeah, it could be diabetes that complicated into those oral ulcers. So you will also have a risk factor of acquiring kidney diseases such as kidney failure. That's what really makes diabetes to be a very dangerous disease. Because you can have diabetes mellitus and you end up getting almost all the diseases we've talked about.
Yes.
If you don't treat. By the way, complications mainly come about due to delay in intervention. If you delay to treat, to diagnose, that's what you're going to do to face.
In a nutshell, to summarize what my colleague has said is that there are acute complications and
chronic
complications. In acute, that's where we find diabetic ketoacidosis and then hyperosmolar hyperglycemic state. Those are the acute. Acute means something that medical condition that is within a time range of less than 14 days. Then chronic means that the medical conditions has persisted beyond more than 14 days. That means diabetic ketoacidosis is what he has been trying to explain in the pathophysiology. Increase of the acids. Are we together? Yes, increase of the glucose levels in the blood. Yeah, then the other one, hyperosmolar hyperglycemic state, it is characterized by hyperglycemia, then dehydration, severe dehydration, not this mild dehydration where you feel thirsty and you just take a sip of water and you're okay. No, this one is severe dehydration where even the muscle, if you do a skin pinch, the skin pinch will be slow. It will take long to gain its normal shape. Then we go to chronic complications of diabetes mellitus. One, we have microvascular complications and macrovascular complications. Microvascular complication is whereby the high levels of glucose are going to affect the small blood vessels that are supplying the organs of the body, like the eye. The way he has talked, the way he has said that it will affect the eyes, causing retinopathy. Yeah, it will affect the small blood vessels of the kidney, causing kidney failure or nephropathy. That is micro, whereby high levels of glucose are affecting the small blood vessels of our body. Then macrovascular complications are the complications whereby the high levels of glucose are affecting the large blood vessels supplying the vital organs. That's the brain, the heart, the kidneys. Yeah, so with the brain, it will cause stroke in some patients. Yes, then with the heart, it can cause ischemic heart diseases, as he had already stated. That's where the acute coronary disease come in. Yes, and also when the blood, the bigger blood vessels of the kidneys are affected, it will cause the kidney failure, where you will see now the glucose will be passing through the glomerula, the glomerulus, and you will see this glucose or the ketone bodies due to other complications. You will see traces of glucose in the urine and the ketones, as we are going to see when we are looking at the diagnostic criteria of this disease.
Before, actually, that was my next question. In the remaining time, I want us to look at briefly two things. Yes. One is the diagnosis, and then the other is the management. But before, tell us about the diagnosis.
The diagnosis, yes. How you can diagnose that. Yes. Yeah, clinically, we have from a clinical exam, and then we have the laboratory investigations. Clinically, you can examine your patient and see whether you will reach at the diagnosis of DM or there are other medical illnesses or conditions. So clinically, you look at the other symptoms I mentioned earlier on, the 4 P's. Then you also examine. You will see there is where you can even do a spot diagnosis. You see someone with a diabetic foot, which is a diabetic foot, and you ask the patient will tell you, I've been battling DM for so long, and now I've gotten a small wound. These patients have poor wound healing. Then you can tell that this is a complication of DM. That is clinically. Yes, then when you look at the lab investigations, what you will do is to first do the baseline tests. What are they? You can first do a CBC, that is a complete blood count, to help you look at the lymphocytes, the white blood cells, the HB levels, and other parameters of the CBC. You look at the ones that will help you point to diabetes mellitus. Then you can also do the renal functional tests. That is to assess the functionality of the kidney. That is the renal part. Then also you can do the liver function tests. Remember also the liver takes part in it plays a key role in the balancing of the glucose in the blood. Yes, as it produces it also that is you're trying to assess the functionality of the liver. As I said earlier on, that these are vital organs. You can do an ECG, like to check how is the heart still, or you can also do a head CT to check for the brain in case your patient presents with a stroke. Yes.
Now
then, okay, it's okay.
No, please complete, because I was cutting you short.
Okay, then you can also do urinalysis. Urinalysis will help you look at the traces of ketone bodies. As my colleague has said, that there is production. If the body lacks enough glucose for it, it is designed in such a way that it will depend on other forms of obesity or overweight. Yes, that will also help you look at as you're investigating your your patient. Then also you can do HbA1c. It is a glycated hemoglobin. It is also, if you find that it is greater than 6.5%, then that means that your patient has DM.
Okay.
Yes.
I think it is important to know about these tests, because sometimes doctors recommend particular tests and then we think maybe they just want to make money out of our conditions or what, but they are all important. Now, Dr. Travis, as we draw closer to the end of this discussion, now I want to look at the general management and
so basically we are going to look at the general management. We can divide it into pharmacological and the non-pharmacological. Okay. So remember, we have two types of what? Diabetes mellitus, so they are not managed in the same way. Yes, though non-pharmacologically, they can be managed or handled in the same way. So pharmacologically, type 1, remember it is insulin dependent. The body does not have insulin. So the treatment we are going to give is insulin itself. So I think you've seen people who inject themselves with insulin. Yes, so specifically that's the treatment for diabetes type 1. So diabetes type 2 in Uganda, here we use mainly metformin and glibenclamide. Those are the main drugs that we use to pharmacologically manage diabetes mellitus. But cause that is not your part, it is more of the medical part. So I really want to sensitize more about the non-pharmacological management, how you can handle yourself from home in case you've come from the hospital and they tell you you have diabetes mellitus. Yes, I want to conclude with that, and that's what I want all of us to pay emphasis on. So one, we looked at obesity causing DM, diabetes mellitus. So what are we going to do to reduce obesity or to reduce our body weight? So one will be regular exercising. Yes, by the way, on TikTok I've seen one coach has been talking about obesity. Yes, and he talked about DM. So I advise my viewers to carry out regular exercise. You can play football, you can go to the gym, a woman can play netball to reduce on the weight, to cut on those fats on the body. It is healthy. So another non-pharmacological management would be reducing on the alcohol consumption. Tonywa nnyo. Tunyweka akali medically what? Prescribed mpola mpola. So too much alcohol could cause DM, could complicate DM. So if you have diabetes, reduce on the what? On the alcohol. So second, I advise people to quit smoking. Yes, smoking is also a big thing that complicates DM into something else. Another non-pharmacological management would be the diet we take. I advise people to have a well-balanced diet, have those fruits, have those vegetables. Yes, have something. By the way, people should avoid prepacked foods. Yes, I've seen people buying those beans in the hospital. Okay, they're not bad. Yes, but if you have diabetes, try to have something natural. Yes.
Okay. I know our time has it's almost gone, but Dr. Chris.
Yes, please.
What are your closing remarks as we wind up this discussion?
Yes, our dear viewers, thank you for watching us and keeping on Family TV. It was really nice hosting us. So when I talk about the goals of the treatment that we have looked at, I'm trying to simplify it for a layman over there, so that we can see how we can go about this diabetes mellitus. It is to reduce, follow what the medical workers encourages you to do. Try to do what our people, the people over there watching us, endeavor to treat the associated risk factors, as my colleague has said. Do regular exercises, cease alcohol taking, and cease smoking. Otherwise, it has been a good session and a good experience with you, Mr. Austin. Thank you for hosting us.
We are grateful. Travis, your closing remarks.
First of all, I would love to thank you for hosting us to sensitize our dear viewers about diabetes mellitus. Let me hope we've learned a lot from it. And those who are suffering from diabetes mellitus, God first. I know everything will be okay. Those who don't have that disease, as we've talked about it, please try to protect yourself, reduce the dangers that could cause that. And lastly, I would love to thank everyone, my mom, everybody out there, dear viewers. Thank you, all of you, for being here. Yes, thank you, Mr. Austin, for hosting us.
Thank you so much, Dr. Travis. Thank you so much, Dr. Chris, and you, our viewer. It's a pleasure. You're such a wonderful audience that has been following, and I believe you have really learned a lot. Yeah, I've learned a lot, and you know, I really need more knowledge. But of course, we meet again next week on Tuesday. Before we go, I would like to remind you that St. Mark's College, Namagoma, has organized for us Christmas cantata, the 6th edition of their Christmas cantata, and this time around it is in Kampala on Theatre La Bonita on the 6th of December, which is this Friday. Yeah, 2 days to go. So on Friday, look no further. Just go to Theatre La Bonita. Now, 6th is a VIP show, 200,000 shillings, but this of course comes with dinner. So it is a VIP treat, 200,000 per person. And of course, take your family, take your loved ones to be part of this experience under the theme, Breath of Heaven. And then on the 7th, that is the following day, Saturday, still this week, there is now the family show. Now the family show, the adults are paying 50,000 shillings and the students are paying 20,000 shillings. So as long as you're an adult, you're paying 50,000 shillings. This is a family show, so carry all your family members, carry all your loved ones, take them to Theatre La Bonita starting at 6 p.m. for both days. So you can as well get your ticket on www.tujaguze.com. And we want to wish you a blessed night from the entire team.